order to speak.
Oh, we have
Oh, okay.
microphones that we're viewing. All right, so we'll go ahead and get started. It is my pleasure to be here today with Dr. Joel Gittelsohn. He is a professor in the Center for Human Nutrition and Global Obesity Prevention in the International Health Department at Johns Hopkins Bloomberg School of Public Health. Dr. Gittelsohn is a public health nutritionist and medical anthropologist who focuses on developing, implementing, and evaluating community-based programs for the prevention of chronic disease in underserved and minoritized communities. He has more than 280 publications and has led multiple successful food source-centered intervention trials aimed at improving the food environment and supporting healthy food choices. Please join me in welcoming him.
Thanks. Thanks so much for the invitation to be here today. Can you hear me on the recording? Okay. Okay. I really appreciate the invitation, and this is actually my first venture out of the house, aside from work, in 3 years. So it's like my first real trip. So I'm excited. So the title of my talk is Environmental Interventions to Improve Healthy Food Access in Baltimore, Moving Beyond Corner Stores. I do work in other settings, but today I decided to make a wild attempt to constrain myself by just focusing on Baltimore. And so I'm going to do a little bit of introductory stuff on the food environment and health, just a little bit, talk about educational, environmental, and policy approaches for improving healthy food access. And then the most of the presentation is going to focus on this part. I'm going to talk a bit about the past completed work, and then I really want to go into the new projects because we've been fortunate to get some funding for some brand new projects to improve food access in using very different and I think fairly unique ways. So what about the relationship between the food environment and diets or health or obesity? To be very honest, the findings on this are very, very mixed. There is no, well, I'll have to say the older studies made me really happy about working in this area. So they said, you saw a lot of studies of the original stuff that said that basically more grocery stores means a better diet. If you don't have supermarkets or grocery stores, you get more obesity. If the further away you were from a grocery store, the more obesity that you would have. But a lot of the newer systematic reviews have indicated that there's a lot of null effects. There's frankly more null effects than there are positive associations in the way you would see. There is some exceptions. For example, there is a review of about 18 studies of the relationship between the food environment and diet and health in China, which did show some fairly positive results overall. What I think one of the challenges has been in this measurement is that people have used what I call relatively simplistic measures of the food environment. How close are you to a supermarket? Or how many supermarkets are there within X amount of space, like a mile or something like that? And people have not investigated things like the type of food source. What are the different types of food source near you, or as much? And certainly has spent a far less time focusing on what types of places people actually use, what are their preferred food sources, and all of that's important. And a lot of this previous work is focused just on retail food stores like grocery stores. So that's been a limitation. Whoops, how did I do that? There we go. So, but what we found is that the type of food source does matter, that it's a mistake to pay attention just to supermarkets and grocery stores. And there have been a number of studies that showed that there is actually a negative relationship between being near a small, very limited food source and different types of prepared food sources and different types of health status indicators. So food source matters. So given this complexity, how can we think about in public health improving the food environment? And so I'd like to just sort of give my 3-slide summary of how I've thought about or think about approaches to improving the food environment. And so I think about educational interventions. And in terms of working in a food environment, I think of educational interventions as helping people make choices among what's already available to them, right? So we're not changing access really. we're changing the choices you make within what you already have access to. Environmental interventions, conversely, change what is available to you. It changes the available options to you. It makes maybe makes healthier choices more available, more accessible, or maybe makes unhealthy choices less available or less accessible. And what can we do to change food access? We can change availability, making things less or more available. We can change the price, that has an effect on that. We can change the ease of obtaining those items. So we can make it easier to get to a healthy food store. We can make, once you get to that healthy food store, finding those healthier items more easy, or we do different kinds of signage or marketing to help people find those healthier options within the food store. I guess conversely, we could do the same things for the unhealthy foods. We can make them less easy to find. We could hide them in the back. We don't need to put them in cash registers. Changing access to foods within neighborhoods and communities. You can think about actually creating new institutions. You can think about building new supermarkets. There's lots of financing programs that exist in Philadelphia, even in Baltimore. We're doing this kind of thing, developing new farmers markets, improving transportation, introducing urban farms. These are all different general strategies for creating institutions that would improve healthy food access within many different types of settings, including cities. Or you can work within the existing structure. You can work within the existing retail food store and prepared food source structure and make these kinds of changes that I've listed here, decreasing availability of unhealthy foods, increasing availability of healthy foods, physical location, renovation, manipulating price. And this is the area that I focused on the most in my work, is changing what's going on with the existing food source structure. So these two options, and then we can think about supporting the educational types of interventions, the environmental types of interventions with policy, right? And I'm not going to go into any kind of description about all of these different policies. I'm sure you're very well aware of them, but these are some of the policies that are being tested mostly at the city level around this nation and in other places as well. So looking back at all of this work, what's my understanding so far? I don't think there is a single silver bullet. No single solution from those menus is going to do it. We need to be looking for the best combination of effective solutions, but we need to be parsimonious. We can't do everything. We need to think, though, about multi-level, combined education, environmental change, and policy to support those kinds of changes. And the best combination isn't going to work everywhere. It's going to differ from setting to setting. So now I'm going to talk about Baltimore. So in Baltimore, how have we been testing different types of interventions, primarily within existing food sources, to improve healthy food access? So a little bit about Baltimore, city of about 650,000. They used to be called food deserts. Now they're called healthy food priority areas. But about 25% of the residents of Baltimore live in what we call healthy food priority areas, where a very large proportion of the population live below a certain percentage of the poverty level. There's limited personal vehicle access, and people live generally far from the supermarket. Just because it's a place where there are no supermarkets doesn't mean there is not food. There's actually plenty of food and plenty of food sources in these settings. There tends to be tons of corner stores, small grocery stores, carry-out restaurants, very common, especially in the healthy food priority areas of Baltimore. And so, in fact, Baltimore's food system is actually quite complex. This is a rundown. So you could think of the food system as being, well, the food flows from producers to wholesalers, to food sources, to households, to individuals. Baltimore has 633 small groceries or corner stores, about 80 chain and convenience stores, about 800 plus restaurants, about 47 supermarkets, 6 public markets, 24 urban farms, 225 food pantries. What did I click on? 55 dollar stores, 50 pharmacies, about 191 public schools, 41 recreation centers. That's not counting the Boys and Girls Clubs. Food assistance, of course, is there. What did I leave out? Oh, local farms, farmers markets. There's a lot going on, just as there is, I'm sure, in most urban settings in the US. And figuring out where you're going to work in and what makes sense to work in is actually somewhat of a daunting task. Which of these places makes the most sense to work at? You can't work in all of them. You can only work in maybe a few of them at most. Which ones make sense? I'm going to tell you our process. So here's a description of our process for the first 2 decades of this work. So we've run a series of projects, and they're represented by logos here. And what I've tried to do is indicate at what levels they work at, sort of simplistically, from a consumer level to the level of a seller or provider, but this could also include a food pantry, which isn't selling anyone, but to suppliers, to a policy level. And so this is sort of the progression in time. And I'm going to talk a little bit about just a couple of the early examples, just to give you sort of a taste or a flavor for how this work looks like and how it's evolved. So the very first project that we did in Baltimore was called Baltimore Healthy Stores. We worked pretty exclusively or heavily with corner stores in East Baltimore. The green area in the map was the intervention area. West Baltimore was the comparison area. And we sampled about 6 or 7 small stores per area. We had a consumer sample as well. And I'm leaving out a lot of background. So I'm leaving out the whole formative research work that we did, the community engagement process that we did, which were extensive and really led to the development of these strategies and these interventions. But there were 2 main strategies. One was increasing supply of healthier foods. So in 5 phases, each phase introduced 1, 2, or 3 new healthier foods. These included low-hanging fruit, which were not fruit. By the way, fruit is never the low-hanging fruit if you're deciding what to ask of the corner store stock. It's a very high fruit, I would say. So we provided stocking guidelines, promotional materials to create demand, an incentive card to the wholesaler to reduce the initial risk that every single corner store owner communicated to us. They would say something like, "Oh, I've tried stocking these healthy foods before. They didn't sell. I lost money. The food went bad on the shelves. I'm never going to stock that food again." So they have very strong perception about this category of foods that I'm calling healthy foods. And they were very resistant to the idea of even trying to stock it. So we had to give them about a $50 gift card to their wholesaler for each phase to encourage them to do an initial starting stock. The other part of the intervention was aspects to increase demand at the point of purchase through visual materials, taste testing, free samples, these sorts of things. So supply and demand, these components were to balance each other. Some initial results. So we saw significant increases in our intervention stores in terms of the stocking of our 10 healthier foods and in terms of reported increases of sales of those healthier foods. And these persisted. So this was post the introduction of that food, and this was 6 months post completion of the project. So we actually saw some significant increases in both the stocking and sales of these foods in this relatively small number of corner stores. We also looked at our consumer results, and after some adjustment, we saw a significant impact of the intervention on food preparation and frequency of purchase of healthier foods, and a trend for improved healthy food intentions. All of this stuff is published, very easily accessed.
A few of the foods that were healthy.
So some fruits tends not to be big on vegetables. So bananas, apples, oranges, whole grain products like bread, like whole grain breads, lower fat milks, not anything startling, not like raspberries or something that might be ultra expensive. In fact, the foods that we selected, and this was on the basis of the collaborative formative work that we did in the community workshops, were foods that everyone told us were acceptable and affordable, right? So you don't want to say, hey, eat these little package of raspberries and it's only going to cost you $8 or something like that. That's ridiculous, right? It's in this particular setting, that would not be a promotable food. or an acceptable food. The follow-up project, though, was a project with carry-out restaurants. In Baltimore, on every other street corner, there's a corner store. Pretty much right across the street, or maybe right next door, there's a carry-out restaurant in the low-income areas of the city. And this is a example of one of them from the outside, and there's the menu. That's actually a really nice menu. Many of the menus were handwritten, are not so nice. There are about 500 carry-out restaurants in Baltimore City. You saw from my previous slide, I said 800 restaurants, but carryouts are a subset of restaurants, of all restaurants. Carryouts are independently owned. Food is prepared for off-premises consumption, so you don't sit down and eat. There's no wait staff or anything like that. Here's some examples of some of the foods sold at carryouts in Baltimore. They're very much the deep fried foods, fried chicken, French fries, lake trout, pizza, sub sandwiches. This is the famous chicken box. It's basically deep fried wings and French fries. This is lake trout. Does anyone know what lake trout is? What is it, Barry?
Well, I know what lake trout is in where I grew up, so I don't know what your lake trout is.
Interestingly, lake trout is neither from a lake nor is it trout. So it is a ocean caught white fish or whiting, but it's very, very deep fried and so forth. And I've begun exploring the origin of that term. There's not agreement about this, and there's lots of theories about why lake trout is called lake trout. It's a thing. It's a Baltimore thing. You just have to accept it. So, but these are some of the most common foods in carryouts in Baltimore City. We developed an intervention called program called Baltimore Healthy Carryouts. We worked in 8 carryouts, 4 intervention, 4 comparison. The first step was a menu redesign. I mentioned that their menus were often atrocious. I mean, like handwritten on cardboard and very not good. So we did a complete menu overhaul, like makeover, put it that way. We did a menu makeover for the carryout owners. They're pretty ecstatic about this. We didn't change anything on the menu. We didn't add things or subtract things, although we did emphasize some things stolen from McDonald's. So we emphasized the healthier options. So okay, don't get on my case here, you know, cold cut sandwich, what's so damn healthy about that? So it was healthier than many of the deep fried options in those particular settings. So we promoted healthy sides and beverages as a second phase, and we developed a healthy combo meal, which 3 of the 4 stores sold at a discount. So we had these 3 intervention strategies in carryouts. Here's some examples of some of the materials at one of the carryouts. And these are some of the results. This is looking at compared to baseline, changes in sales by phase. So there were 3 phases of the intervention. The orange is the 4 comparison, purple is the 4 intervention. And we saw quite significant increases by phase in terms of sales of the healthier foods that were being promoted compared to baseline. Even with just changing the menu, not actually changing the items on the menu in any way, but just advertising, like pushing the healthier options a little bit more. This is looking at the proportion of the sales of healthy to unhealthy, like it's a sort of a ratio, because what you would worry about is, well, yes, Joel, maybe you got them to eat or to buy some more of the healthier foods, but what if they just, did that on top of the unhealthy stuff? We actually saw essentially the same results when we looked at the ratio of sales of healthy to less healthy items compared to baseline, although we did not see that same impact at the end of the first phase associated with the menu. And this one is about total revenue. I will have to give a big shout out to my doctoral student, Dr. Sung-Hee Lee, who worked with these stores and somehow convinced them to turn every single sales receipt over to us for weeks on end. And we were able to, because we knew how much each item cost, and we were able to see that compared to baseline, our intervention carryout saw a 20 to 25% increase in total revenues compared to our comparison carryout. So we actually saw increases in total revenues. I know you're going to ask, what about profit? I don't know. Because profit is very much related to their costs to purchase those items, and we did not have the cost information. So those were the first two projects that we did in Baltimore, and we followed up with at least 4 more. And here they are listed. I'm not going to go into detail on these, but you can see that they were a little bit more of the same, but adding different places, like Baltimore healthy eating zones. We added recreation centers, and we worked in both corner stores and carryouts. This Be More Healthy Retail Rewards, we added wholesalers. We tried to connect with wholesalers, the suppliers of the corner stores. Be More Healthy Communities for Kids, everything. Let's put it all together and see if we can get a result. This one was focusing just on corner stores that accepted WIC and trying different behavioral economic strategies to encourage WIC purchasing and by customers. I'm not going to go into these in great detail, but I am going to try to summarize in general what we found if you sort of put all of this together. In general, and if you look at our papers on this, at the wholesaler supplier level, I think we've been successful in these interventions in getting them both to increase the stocking of these foods and their sales of these foods. In the corner stores and the carryouts, again, stocking and sales of the healthier foods and beverages. I will say we don't have a handle on profit, right? And that would, of course, be quite interesting to add in the future. And then in the one study where we looked at WIC products, we saw increased stocking sales of WIC foods as well. Among consumers, we've seen increased purchasing of these foods and their consumption. That's been pretty clear. We have seen in some cases, in a couple of the studies, an improvement in BMI, but in others, no. And in some of them, we have not measured it. It wasn't even intended as an outcome. But among the 3 or 4 of these projects where we had it as an outcome, a couple of times we saw an impact as we did. So what's the conclusions and how to move forward from this past work? So I personally think that food environment interventions can be effective in addressing some of the key risk behaviors for chronic disease in disadvantaged communities. These different types of multi-level, multi-component interventions, I think in general have been successful in improving access and consumption of these foods. I think we've learned the importance of combining educational and environmental approaches, although I haven't yet brought in the policy angle, but I will. But at the end of this, I was sort of left with trying to think where to go next with this work, because we had done some very expensive, very time-consuming, very large trials, and we'd had some impact, but was it like earth-shattering? No, it wasn't really earth-shattering. And in the last 3 or 4 years, I've been thinking a lot about where to go next with this body of work. Are there some more specific challenges that we need to work on? And so I've, to some respect, moved away from this idea of let's do everything, right? This multi-level, multi-component. And so I'm going to tell you now, I'm going to move now into what we are doing. So the present. The first thing that we're doing is a project called BUD. Funded about 2 years ago with an R34. BUD stands for Baltimore Urban Food Distribution app. It's a mobile application to improve healthy food access in Baltimore City. Why are we doing this? The reason is because one of the things we've discovered over these years is that if you are a healthy food, an unhealthy food, like a bag of potato chips, you have an entirely different distribution system available to you than if you are a healthy food, like an apple or an orange or some fresh produce. The bag of potato chips is a strong, robust delivery system. And it's external vendors. The Lay's potato chip person comes and delivers it. The Pepsi Cola person comes and delivers. They'll restock the shelf for you, for the store owner. They will provide display racks or refrigeration for free. Typically, they'll give a reduced price discount. So there's strong supply, strong demand. There's also, we discovered lots of both sometimes formal, almost like cigarette company agreements with even very small corner stores. There'll be at least informal agreements. If you stock my product, I'll give you some extra, that sort of thing. And lots of incentivization. On the other hand, if you are a healthier food, this loop, the supply-demand loop is very weak. And the corner store owner actually has to generally go out and get it themselves. This is not an easy thing for them to do. Corner stores typically are literally mom and pop oriented, not an organization, businesses. And so if pop has to go get the food at the wholesaler, then mom's alone at the store. So if they wanted to get the food delivered to their store, it tends to be costly, and you have to buy a lot for that delivery to come through, for them to feel it's worthwhile delivering. So it's a very different form of distribution, depending upon whether it's quote unquote a healthy versus an unhealthy food. So we are in the process of developing BUD, the Baltimore Urban Food Distribution app. And this is the main menu. So basically the way that this works is you can look up products on the app. The products are placed on the app by the supplier. The supplier could be a wholesaler, but it could also be a local farmer. In fact, in our pre-pilot, we ran a pre-pilot, we actually had the supplier was a farmer, and that's what we use. So they add products to the app. We are implementing something called a buddy up deal, which is essentially collective purchasing. If X number of corner store owners get together to purchase a larger amount of a product, let's say, no corner store in their right mind is going to buy 100 pounds of strawberries. But if 7 of them do at 15 pounds each, this makes a lot more sense if they do it through collective purchasing. So there's a collective purchasing function on the app. And Lyft is going to sue me, so I'll probably end up changing the name of that. But also a shared delivery option is being added to it as well. So that if you purchase a buddy up or a collective purchasing deal, one of the persons can volunteer to pick it up and deliver it to the other people. And this will lead to an additional discount for them. We are exploring the possibility. It's not part of the funding that the R34 covers, but we're exploring the possibility of a additional component which would connect consumers, community members with the app. Right now, the app is about getting food from suppliers to corner stores. That's the main function of the app. But connecting in local consumers or community members to find out where the stores are, for example, that might be carrying XYZ healthier foods. They can request foods to communicate with the stores. They can write reviews of stores. These are some things that we're planning or thinking about for a future addition. Yeah. Right now, this is where we are. We're midway through this project. We got well behind because of COVID and online challenges. But we're gearing up for the pilot trial in a number of corner stores in Baltimore. Future directions, if this is successful, we've actually already been funded to expand to rural Charles County in Maryland to 8 corner stores or small stores in rural Charles County. But we want to move to a RO1 in the future, which would be a scale up to all of Baltimore. Right now, we're just in East Baltimore. All of Baltimore, we have a partner in Detroit that so we're thinking at least Baltimore and Detroit. And then we have had a lot of suggestions to adapt the app itself to other food venues. Like, could you use this as a way to supply food pantries? I don't know. These are things that we're talking about. Next new thing, fresh. And you'll notice that the arrow extends up to the policy side. So FRESH stands for Focus on Restaurant Engagement to Strengthen Health. It's a little tortured, okay, I admit, but the term FRESH in Baltimore is actually a really good way, alternative to saying healthy. You know, healthy, most people, that term implies tastes bad, maybe it costs a lot, these sorts of things. But in Baltimore, at least, the term fresh is actually a very powerful and resonates with people well. So we just recently received an R01 to conduct the fresh trial. My MPI is Gittelsohn Ramos at George Washington University, and my part is going to focus on working in carryouts in African American neighborhoods in Baltimore City, and her part is going to focus on working with Latinx neighborhoods in the DC metro area. The aims: to use system science approaches to refine a successful restaurant intervention for low-income neighborhoods, to assess implementation in 24 restaurants, to assess impact on diet quality, that's the primary outcome, and some other indicators, and develop and apply a systems dynamic restaurant simulation model. And this is the part that's aimed at linking in policymakers. I'm going to say a bit more about that as we go along. Honestly, I think this is the part that excited the reviewers the most, was this sort of added value of developing a tool that could be used by policymakers and stakeholders elsewhere to sort of gauge the potential impact or unexpected consequences of implementing similar sorts of restaurant interventions in their own cities, their own settings. So number one, aim one, it's the system science approaches. It's basically the formative research aim. I'm not going to go into the great detail, but I'm going to say that one of the products of this, it's a lot of the usual formative research stuff. We're going to talk to restaurant owners, we're going to observe in restaurants, get an idea of what's going on, who their suppliers are. But we're going to also do group model building workshops at each site and create causal loop diagrams of the factors influencing the systems of restaurants. And here's a causal loop diagram example in case you haven't seen one before. This one was prepared by Eli Mui, who is an assistant professor at Hopkins. This was based on her dissertation work. This is not directly related to our project, even though there are chicken box stores. That sounds a little bit like our project. But basically, in a group setting, you develop this fairly complex system of the factors that, in this case, influence the foods that stores stock, how they make decisions and choices, how that influences with other community factors, and so forth. So we'll be doing this, but centered on restaurants, restaurant decision-making, their stocking, the factors that influence what they sell, the role of customers, all of these sorts of things. And this becomes the qualitative basis for a quantitative simulation model, which will come later. What does the intervention look like? It's going to have three main components. The first is a food preparation piece led by Julia Wolfson. Julia Wolfson is a new faculty in my human nutrition program. She was a professional chef for 10 years, and then she got her PhD, and she does cooking interventions. And so she's going to train restaurant staff on healthier cooking strategies. Second piece, this is my piece. Working with wholesalers and suppliers that provision the restaurants to make sure that the restaurants have the items that they need to have to be able to do the intervention, and that they are accessible, that they're affordable to the restaurants. Third piece, changing the consumer nutrition environment, using a lot of the techniques and the types of materials we developed for Baltimore Healthy Carryouts, and my MPI, Gittelsohn Ramos, did a project called Water Up, which also worked with restaurants. That's and so bringing that in. Does anyone know what that picture on the right is? You get 5 points if you know.
Lake trout.
Fried spam.
It's not lake trout.
Banana bread?
The closest was Peggy here. This is Scrapple. So in case you have heard of Scrapple, have you heard of Scrapple? Yeah, of course you have. So it's Pennsylvania Dutch originated. You take all the parts of the pig that aren't in cuts of the pig, like you take off the loin, you take off the bacon, you take all of that, and what is left ears, skin, whatever, is boiled, further boiled, boiled some more, becomes a brown, kind of a gray sludge. You put in some cornmeal, you put in some spices, you pour it into molds, you boil it some more, you put it into a mold, you let it sit, and you've got scrapple. And some people swear by it. I'm not a big fan, but it's in the carryout restaurants.
Did you eat some?
Oh yeah, I've had it. It's kind of like Spam, but gray. It's gray. It's really gray. The third aim is to assess the impact of fresh on diet quality and secondary. So this is the impact aim. And we have a sample of customers, and we will be assessing essentially 12 customers from each of the restaurants, and these are our outcomes that we're going to look at. And of course, we have additional assessments at the level of the restaurant and the wholesalers and suppliers. This is the study design. Essentially, we're going to be working in 16 neighborhoods, 8 in Baltimore, 8 in DC, half intervention, half comparison. And we will work in 3 restaurants per neighborhood. And we did not choose to randomize by restaurant because we were afraid that we would get restaurants quite near to each other, one intervention, one comparison, so we're randomizing by neighborhood. The fourth aim, the one that I think excited the reviewers the most, is developing and applying a system dynamic restaurant simulation model. And the goal is to develop an interactive dashboard behind that, so the back end of so the front end is this beautiful dashboard, hopefully, that policymakers can use to, sort of show potential impact, unexpected consequences of implementing restaurant type interventions. The back end is the simulation model, of which the very first step will be that causal loop diagram, or those series of causal loop diagrams. So, so the goal is to develop this simulation model. A few words about what they are. I know many of you know. So computational models for depicting complex systems. There are many different types of simulation models. We're doing a systems dynamic model, but there are many different types of simulation models. And what they are going to do, or allow us to do, is to allow the user to virtually test different policies and programs in this virtual world. That's the idea. And you can compare the impacts of different maybe levels of enforcement. Or what if I only get through to 10% of the restaurants, what's the impact going to be there as compared to other models, other ways of doing it. And this is kind of how the different aims feed into the model. So the first aim, the formative aim, creates causal loop diagrams. The baseline data collection is going to provide additional information for parameterization of the model. And then the implementation, that's the process evaluation, and the impact evaluation is going to provide information for calibration of the model. So I think this is what reviewers liked, was that there was a really tight interplay between the intervention that we're going to do and this simulation model that we're planning to develop. This is a completely concocted output, our dashboard image that we created, which has no basis in any reality, but hopefully it made a good impression on the reviewers. And just to give an idea, well, you could change, where what things are like. Do they have a menu labeling policy? How often do the health departments inspect? What's the neighborhood characteristics? You can set that. And what are you going to do in the restaurants? And what kinds of intervention are you going to do? And you would have an output, right? In this case, just as an example, a healthy eating score or something like that. Future directions of this project. We want to, of course, disseminate the intervention itself. We want to promote the systems dynamic model by local governments, and we hope to parameterize the model further by implementing this project in other settings, possibly rural areas, possibly chain restaurants in different settings. Okay. Dollar stores. So we received some funding recently by the Center for Science and the Public Interest to work in dollar stores. And this is So I actually never thought about working in dollar stores before. I had stayed away. I've stayed away from all chains as much as possible because I find them impervious to public health intervention because everybody says, oh, interesting, talk to my regional manager. 2 months go by, you finally hear back from the regional manager. Oh no, talk to our assistant marketing director in charge of corporate public whatever. 3 months later, you get to that person. It's like this, it's impossible. But there's a lot going on with dollar stores these days, and we are getting involved in this work. So first of all, they tend to be located in very low income neighborhoods and especially seem to be directed to those settings. In areas with very low healthy food access, they tend to not have a whole lot of healthy options, although some of these are changing, but a lot of ultra processed food. So a lot of expansion happening, and there's been a lot of community pushback and legislative pushback in different settings and communities against dollar stores. Feelings that dollar stores drive local businesses out of business. Feelings that dollar stores are not healthy, that maybe they're pretty crappy looking sometimes, and so forth. So some other things. One big difference of a dollar store is that dollar stores are not just food stores. In fact, that's in some ways quite secondary to their purpose, in my view. Dollar stores sell medication, they sell clothing, they sell cleaning supplies, they sell seasonal items. Like if you want to get your Halloween costumes cheap, you would go to the nearby dollar store. They have many positive, at least perceived by the community, positive functions. So it's not a simple thing. Is the dollar store a good, healthy food store? If they are, let's keep it. If they're not, let's get rid of it. It's not a simple thing like that because they serve these additional purposes. In Baltimore City, there's 55 of them. Many are located in healthy food priority areas. The Maryland State Senate has implemented a bill 869, which requires a study be done of dollar stores, and guess who's doing it? Yes. So the aims: to conduct the Maryland State required dollar store study, to characterize the food environment in Baltimore in order, like what do they sell? How do they engage or interact with food assistance programs, customer demographics, these sorts of things? To develop and support and develop recommendations for dollar store policies for the city of Baltimore. The city of Baltimore is basically, the city council has been tasked with coming up with some legislation to regulate dollar stores. And this information will help them in making that decision. It could go one of two ways. One way is dollar stores are evil. They need to be kept out. We should put a moratorium on dollar stores. They basically shouldn't exist in Baltimore. The other way is, well, dollar stores have all these positive features as well, and maybe we could do some, like a staple foods ordinance for dollar stores, require them to stock a broader array of healthier foods, maybe require them not to stock so much ultra processed foods, something like that. The city council has not decided. It's basically one direction or another. So the fourth aim is to evaluate the impact of the policy on the actual change in entry or exiting of dollar stores in Baltimore, its impact on existing retailers and on healthy food access. Just a few slides. What does a dollar store look like now? I don't know if you've been in a dollar store.
Are yours all Dollar General or which
They are all
chain?
three. Dollar Store, Dollar General, Dollar Tree.
Wow, that's right.
Yeah, we have all three. Plus, we have some independently owned dollar stores. I don't know what to do about them. So people who call themselves a dollar store, and you go in, he has the one store. I think these are very entrepreneurial people who somehow avoid getting sued. But and they typically don't sell food, so I basically ignored them. But if you look at a dollar store now, it may be different from the interior. Like I hadn't been in a dollar store in about 6 years. And when I went 6 years ago, I was not impressed in terms of the food offerings. Nowadays, things are changing, and a wide display of packaged foods, frozen foods, and increasingly fresh foods. So it's not dollar store, well, my opinion, dollar stores are not necessarily evil, right? I mean, they have this potential to be part of the healthier food environment. So we're in the process of doing this work. This is where we are. So what I've tried to get here is the whole policy process and what's happened. So a little bit along the process. The Senate bill was introduced in last February. They passed the bill in July. We got funding. We're proceeding with our data collection. And then we have to have stakeholder workshops where we get back to the recommendation. So a few preliminary findings just to sort of whet your appetite. As I've said before, a lot of community members, and this is the numbers of interviews we've done, and you can see that we haven't done all of the different kinds of interviews we want to do. Many community members view dollar stores positively. They're filling a need, such as cost savings on especially non-food items. That, where would the community member get those cleaning supplies elsewhere nearby? Dollar stores may be the fix. They often are seen as supplemental to grocery stores in terms of food. They're not, most people aren't really doing their big shop at the dollar store. But if it's the only food store that's nearby, then they might be used for those purposes. But most community members at least say they like the stores to stay, but with some changes. They want them to look better. They want to improve staffing and wages, security, and this mixed feelings about adding healthier options. This is actually from the dollar store staff perspective, because they see this as a challenge to be able to add healthier options when they're not used. So I would say dollar stores are very strictly controlled as far as I can understand. They don't, the manager of the dollar store doesn't say, oh, give me another 100 cases of this, another whatever, I need more eggs, give me some eggs. No, it gets delivered and they get it and they put it out and it's like all centrally controlled. So adding healthier options, there's some concern from staff about this, and dollar stores are very understaffed. They typically have just 1-2 persons maybe on staff at any particular. So future work, in Baltimore, we're going to be working and continue to take this work into development policy. We're part of the National Dollar Store Research Working Group, supported by the Health and Eating Research Program of the Johnson Foundation. And we're interested in understanding, more broadly, the impact of this policy and others being implemented around the country. Also, Dollar General is planning a produce rollout in about 1,000, I'm not sure I got that number right, 1,000 stores over the next 5 years. That's going to really change the landscape. They're going to add produce departments to their dollar stores. I think this really needs to be looked at. Last one, I promise. SafePass. Another app. SafePass stands for Support Application for Food Pantries. And we just recently received this R34 to develop this app. So the background, high levels of food insecurity. Of course, food banks and food pantries address this need. We did a small pilot trial in food pantries, about 7 or 8 of them, and we had some success. It was your standard, let's do some promotion, let's try to change policies, let's really go gung-ho on client choice models, the things that I consider, this was pre-COVID, standard things that you would want to promote in a food pantry. What we found out at that time, and then during the pandemic, was that the needs of food pantries were pretty different as expressed to us than what we were working on. What they wanted was help with volunteer recruitment, training, scheduling, how to communicate with them, what to do in emergencies, how to communicate with emergency providers and Office of Emergency Management. And we ended up doing a review. And what we found was, in terms of existing digital tools for food pantries, there were existing digital tools for, a lot of them for inventory management. Essentially, a can of spaghetti goes in, beep, goes out, beep, you're tracking stuff. Improving pantry client diet quality and nutrition knowledge, there were some kind of digital strategies along these lines. By the way, these are all reported in a couple of publications one of our colleagues did with us, Nina Martin. So this is all this is published. But there were none, or virtually none, that addressed volunteer recruitment and management or training. None of them that provided any kind of safe choice option. So the problem with client choice is client choice means everybody's going into the food pantry collectively, selecting food like they are in a supermarket, and potentially exposing themselves and others to getting sick. And so not safe, especially in an emergency situation of that kind. But one big challenge is the challenge of burden for pantry staff. Most of the pantries in Baltimore don't do any kind of inventory management because it's so time consuming. To scan each can, there's no one to do that. If they're volunteers, they have very limited hours. They're just not able to do it. So I'll tell you what we did, and needing support to manage disasters and emergencies. So the aims of this R34 are to develop a strategy, to pilot the app in Baltimore-based food pantries in partnership with the Maryland Food Bank, and assess feasibility and evaluate the impact on the healthiness of foods received among clients. We have secondary aims that look at several secondary outcomes, impact on the food pantries themselves in terms of stocking, staff capacity, etc. To assess the impact of SafePass, the app, on some other kinds of consumer or client level outcomes. What does it look like? Still in development. We were just funded a month ago. So, but this is some mock-up wireframes. So a main menu to select the different functions, a series of menus to schedule or manage volunteers, a form of electronic choice that we're calling e-choice, where basically they indicate their broad needs. What foods do they want? Types of foods, not specific. I want Cheerios, but they just say whole grain cereal like that. Their dietary needs, are they low sodium? They need to be kosher, they need to be halal. Allergies, scheduling pickup, and so forth. And then connection with emergency preparedness training, communications, situational awareness books. So basically, the information that would be collected using this app, and this could include things like regular reporting on food, let's say answering the simple two food insecurity questions. That could be fed back to emergency management people, or even just knowing which food pantries are open, or which have room for more clients, or how many clients can they take. That's the sort of thing emergency planners need to know. So we're just at the beginning of this, the very first stage of the formative work. The formative work is going to happen in Baltimore and with our partner in Detroit. And of course, we hope will lead to a future R01 and maybe expand to rural setting. So I'm going to conclude now, and we've been funded, sort of looking forward, we've been funded to test interventions in 4 diverse food environments now, in relatively new settings and at multiple levels. Honestly, I don't know what the best place is yet after 20 years of doing this, which is the best place to work in, or combination of places to work in. And I'll have to say that our projects tend to be pretty labor intensive and costly. And I'll also have to say, well, I can make it to 10 corner stores and maybe 20. There's 600 and something or other in Baltimore, and feels like a drop in the bucket sometimes. So what are the paths forward? I do think that digital tools like Bud and SafePass offer potentially cost-effective ways to expand reach and sustainability. For reach, we could think about other uses of things like Bud, for example, procuring, distributing CSA boxes. Sustainability, we're planning to make the code for these 2 apps open source, so anyone can take the code and use it as a foundation to build upon to implement or develop their own app for their own setting. I do also think that digital tools like simulation models can aid policymakers and others in their planning. And we need to continue to work on that. And part of the way to make that happen, to make those used, is to have them participate in the development and refinement of these simulation models. So I certainly don't do all this work by myself. I work with a very large team, a very diverse team in many ways with health economists. Dan Barnett is a emergency management planner. Here's Julie Wolfson, the professional chef, now associate professor, and so forth. So I work with Jackie Goose is an engineer. He's the one who does all the programming and I don't know how to do that. So I work with a lot of people at different levels. So I want to definitely acknowledge them. So thanks very much for your time and attention, and we could have a couple of minutes for questions. Yeah.
So what policies or incentives do you think would be implemented to better incorporate like farmers into or sort of like local community gardens, urban farms, that type of thing into like the Bud platform or corner stores?
So Baltimore currently has something called the Urban Farm Tax Credit. We actually supported the development of that tax credit through the use of the simulation model to sort of model what would happen if they pass this and if X number of. So basically, if you own a vacant lot in Baltimore, you're paying taxes on it. But if you convert it into a urban farm, you get a 90% reduction in the taxes for 5 years, and I think it might be renewable. So it's a good way if you own vacant land in Baltimore, which there are many vacant lots, I have to say, for you to potentially put that land to good use. So that's one way the city is encouraging local, what I call hyper local farmers.
I'm really curious with the dollar store study to hear more about the impetus for the Maryland state law in the first place. That seems really interesting. And also was curious with the aim that's sort of dependent on local policies being enacted. Do you think that that's going to be feasible, or have any idea on what kinds of policies you might be considering at the local level?
So the origin of the impetus, it predates my interest in dollar stores. So basically what happened was we heard that Senator Mary Washington, she's a Maryland state senator who represents a certain district or part of Baltimore City, had essentially had supported this legislation, this bill in the Maryland State Senate. And we said, wow, that's really interesting. And the CSBI came up with this funding just at the same time, which supported this kind of policy work and so forth. And so we applied for it and we got this. So I can't tell you the original motivation. What the story of Mary Washington, the senator, she tells is that she met with community groups, and the groups indicated that they were unhappy with the dollar stores, that they didn't have good food, that they were kind of dirty, that they were places for a lot of crime. That's what they have. I'm forgetting the second part here.
Oh, kind of a different policy question, but with the local policy, it's kind of built into your grant is that you'll recommend local policies for dollar stores and evaluate them. Do you have a sense of what kinds of recommendations you might think about making, and anything about?
Well, I'll tell you, there may be some contention, because what I'm hearing from Senator is that she wants to ban a moratorium, and the way I'm moving, from what I'm hearing, is that these are useful in these communities and they're used, and that I would rather do let's make them healthier rather than ban them.
Sorry, I just want to watch your time.
Yes, I have to catch an Uber to the airport because I have a flight in an hour and a half.
So I did a thing with Allison Aubrey on Dollar General, and they wouldn't talk to the management at that point, but it was all about the helpfulness of their stores, and it was on this popular Sunday morning 10-minute sketch. And I would suspect you could get to them now to talk about putting some of those in the stores in Baltimore so you could evaluate them. for them as
That's
part of this.
That's a good
Because
idea. I mean, we have, you know, I thought we weren't gonna be able to talk to any dollar store people at all. But we learned some tricksy little moves to do this, one of which was you go on to LinkedIn. You do a search on people in the area that report having worked at dollar stores in the past. And those people are very good people to talk about, even though they're not currently working in a dollar store, they will feel free, hopefully, to talk about what dollar stores are like. And so that was one little technique that we learned. I apologize, I have to run
Yeah.
off and
Leave you.
Why?
Thank you so much.